Hi, my name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida. And today I'm going to talk to you about how to get to the underlying root cause of your autoimmune condition. And in particular, I'm going to talk about ulcerative colitis. And in turn, once you find out what the root cause is, how to then have solutions to help you get better. So I've been practicing over 30 years chiropractic, functional medicine, nutrition, and I've seen over 100,000 patient visits. And just like many of our patients, this young man came in 4 weeks ago, 62-year-old man, and he came in with, as typical, we see a lot of fatigue, depression, anxiety, insomnia, digestive issues, pain, bloating, gas, diarrhea. On top of that, he was obese. He had a very hard time losing weight, and he also had gout, so he had a lot of joint pain, high blood pressure, and a whole lot of other things. He was just feeling completely miserable. So I'll tell you, there's two ways to approach any autoimmune or any type of chronic condition, whether it's thyroid, like we see so much of, digestive issues, any chronic health condition. Is basically two ways to approach it. One is you can choose medicine, the modern medicine route in this case. So he had this condition, gosh, over 40 years ago it started, and went to many different doctors, diagnosed with ulcerative colitis, which again is an inflammatory bowel disease. You get ulcerations, inflammation, bloody diarrhea, a lot of cramping, pain. When you choose medicine, then their treatment is medicine, procedures, and surgery. So like in this case, he was treated with prednisone, a steroid, then still having similar symptoms like chemotherapy, drug, they call them biologics, which then had such severe side effects, caused him to be hospitalized for 3 months. He almost died. Had an infection in the hospital. Soon after he left, then he was readmitted. And after all this, finally they decided surgery. So they actually took out his colon. But now the thing is, this actually didn't fix anything. So even though that's the treatment, the medication, the surgery, he still came into me now 40 years later after with the same pain, the abdominal pain, the diarrhea, the cramping, and 100 other symptoms. So I call that approach, so that's certainly one approach, and I call that actually dysfunctional medicine. And dysfunctional meaning, basically doing things that actually impair the normal function of your body. So you're doing all these medication, procedures, surgery, almost dying, and not left with any solutions, still, and on top of that, having to take a lot of other medications, like 8 other medications, 6 for the depression, anxiety, and all the mood issues, 6 different medications, and medication from, blood pressure, gout, and doing all that. But now if that helped, if that fixed something or even helped him feel good, then then it would be maybe worth it. However, I call it dysfunctional medicine because even after all that and almost dying, still not feeling better, still feeling terrible, still actually feeling worse. So there's something wrong with that picture. It's like having a dysfunctional person in your life. Like we had a dysfunctional person in our office a while back, and So when you have an extra staff member or person in your life, you know, they're supposed to be, it's actually supposed to be helpful and kind of take the load off and actually help you, but with a dysfunctional person or behavior, it actually creates more work. So we actually, even though we had an extra person, it created so much more work for everyone else to clean up this person's messes and the drama and everything else, that it was just a mess. So anyway, the medicine that I like, it's called functional medicine, where we actually get to underlying root causes, and then we can provide long-term permanent solutions. So in this case, even though, again, it came in with no colon and on all these medications and feeling miserable, 4 weeks later, lost 22 pounds. Actually, this is after having not being able to lose any weight. A lot of his symptoms, it cleared up his digestive symptoms. He's sleeping through the night, off some of his medications. His blood pressure within 2 weeks dropped so drastically, over 40 points, that he had to have his doctor take him off the blood pressure medicine because his blood pressure was too low. So he's off that, he was able to get off his gout medication. You know, a lot of the pain cleared up. So he's doing phenomenally well. And what got me, what really inspired me to even talk about this is, so he goes to his primary doctor this week, and he thought he would be like really proud of him because he lost 22 pounds and he's eating healthy and taking the supplements and off his blood pressure and gout medication, and cut down some of his other medications for his other doctor as well. And his doctor wasn't very happy about that. He just seemed kind of ticked off that he was able to get off his medication. Now he's like, well, I guess he had no use for me. Well, because, you know, when you go that route, so when you go to a medical doctor, they're doctors of medicine, and their job is to manage medications. And that's fine if, you know, that there's certainly a huge need for that. And if you're the type of person that wants to basically go that route, like take medications for this condition and that condition, be able to, you know, say you have high blood pressure, high cholesterol. Listen, you just want to take the medication and eat what you want and not exercise and, you know, don't really care, then that's fine. However, if you're the person that would rather choose health and get to the underlying root cause and then be provided long-term permanent solutions, which is a functional medicine approach, the root cause approach that we practice, then that's really what I call choosing health, because you want to actually get better. In this case, just to give you some ideas of what caused this ulcerative colitis and all these other issues. Well, first thing we do is a complete evaluation, a whole body health analysis, and we found out, so the 3 categories that cause autoimmune or other chronic health conditions, thyroid, Hashimoto's, whatever, nodules, are physical, mental, and chemical stress. Those are the 3 broad categories. And in chemical stress area, we look at really 4 areas. Deficiencies, so in his case, he was low in vitamin D, some B vitamins, B12, he's anemic, so he actually had anemia, B12 anemia, some other nutrients, so it's omega-3, he's deficient in omega-3s. So his DHEA was really low, which is an adrenal hormone, so he had adrenal fatigue. Cortisol is another adrenal hormone that was low. So anyway, this alone, because of the exhaustion, the insomnia, you know, the depression, anxiety, and then we look at toxins. Okay, so there's deficiencies, toxins. For instance, well, taking too many medications, you know, you're taking 6 different medications for depression and bipolar and, you know, anxiety, 6 different ones. I mean, that can have a very toxic reaction. High uric acid levels, which is, you know, can cause inflammation of the joints. High triglycerides, those are all at toxic levels. Again, causing a lot of inflammation. Other things, infections. So number 3 is infections. So we have deficiencies, toxins, infections, yeast overgrowth, bacterial overgrowth, leaky gut. Those are all going on. And I mean, ulcerative colitis, one of the primary causes is infection. So you have this chronic underlying infection, probably for 40 years, of yeast, bacteria, you know, causing the leaky gut, which then in turn can cause increased food sensitivity. So that's the 4th category, is food sensitivities, which he had a gluten sensitivity and other foods, 4 or 5 other foods he was sensitive to as well. So I mean, just gluten in and of itself can cause all the symptoms he was having of, you know, the digestive symptoms of brain, the anxiety, depression, bipolar type symptoms, just gluten in and of itself. But he had all of these things going on at the same time. And when that happens, I mean, the great news about that, having so many things wrong, is when we address all of them at the same time, you can get phenomenal results. And that's how he was able to drop his blood pressure and, you know, by over 40 points in 2 weeks, and his weight 22 pounds in a month, even though he wasn't able to lose weight before, and his digestive symptoms clearing up, able to sleep through the night, just feeling really great. I mean, it was rough going through it initially, absolutely rough, but by the 3rd, 4th week, just feeling absolutely amazing, like a new person. So that's how you're able to do that. And as far as the diet we put him on, it is a diet I call the free diet, because it's not only free of gluten, but gluten, grains, corn, sugar, yeast, eggs, dairy, soy, legumes, and GMOs. So those are the 10 major categories. And what that does, it allows the body, it's free of those foods most commonly responsible for inflammation, chronic digestive issues, fatigue. So we allow the body, the gut, to then heal by removing those foods. And if you would like a copy of phase 1 of the free diet, you know, feel free to click below. We'll put a link down there in the video description underneath. So diet was one thing. We replaced, besides the free diet, we replaced a lot of nutritional deficiencies. So we used our natural medicine formulas, probiotics, a specific kind of probiotics, certain vitamins and minerals to get that balanced out. And that's how we're able to, and we did some manual treatment as well for these different joint issues he was having. So that's how we were able to get doing so well in just 4 weeks' time. So if you have any comments, feel free to leave them below. You know, feel free to subscribe to my YouTube channel if you want early notification of new videos. And just remember, you know, whatever issue you have going on, whatever chronic health problem you have going on, I mean, your body has an incredible ability to heal. So if you just look into finding those underlying root causes, I believe most every problem has a solution. Most every health problem has a solution, I believe. So once you find the underlying cause, you can find a solution. So thanks again for joining me today. If you want a copy of the free diet, just click below in the video description. Look forward to seeing you next time. Take care.